This is Dr. Clay Williams at the University of Texas Health East Texas Medical Center in Tyler, Texas. There's different ways of categorizing incontinence or leaky bladder. There's urge incontinence, where the urge gets you and you've got to go, and that's usually treated with dietary fluid modifications and medications. Stress incontinence is where the urethra, the urinary channel, is hypermobile. So when you cough, sneeze, laugh, jump, exercise, it tends to siphon urine, and so we need to place a sling, a polypropylene mesh, to slightly suspend that. And I've got another video that talks about the Slings mid-urethral sling, or the MISSES, the minimally invasive single incision sling, where I can do it between 4 to 8 minutes. Recovery is about 1 week, where you can resume all physical activity, including sexual intercourse, where that is not the case with 99% of slings and urologists, or even urogynecologists, where the recovery time is 6 to 8 weeks and it's much more painful. There's been a lot of talk about UBAs, urethral bulking agents. Now, we've done a lot of things like coaptide, macroplastic. None of these have been all that great. They kind of work, but not great. Some are more difficult to inject. There's really 2 on the market now currently. So one of them is a particulate matter that is suspended in a carrier gel, but because of the carrier gel, it tends to dissolve or reabsorb fairly quickly. The other UBA that's on the market is a non-particulate substance that's in a hydrogel, and because of that, it tends to stay and remain a lot longer, as it kind of creates cushions inside the urethra. So you place a cystoscope here in the office, and with a small needle you inject either one of those 2 products inside the lining of the urethra, deep into the tissue, and when you place the substance, it pillows, or it cushions out, it spreads out, and therefore it closes off the urethra and helps prevent stress incontinence. So these 2 on the market are very nice. The problem I have with UBAs is I don't think they are as good as what is reported in some of the literature. Some of the literature says that the satisfaction rate is 80%, but what they don't really tell you is that these do tend to wear off. Some patients find it to be a little bit uncomfortable to perform it in the clinic setting, and not everyone gets a really good effect out of it. But it's a nice option to offer ladies with stress incontinence, especially maybe if they're not good anesthetic candidates for, maybe they're on blood thinners, they can't come off, they have cardiac issues, pulmonary issues, maybe they're up in age and anesthesia is a little risky for them. But the way I do the Slings sling, the minimally invasive single incision sling, it only takes me 4 to 8 minutes, and I do it under propofol sedation. So there really is no anesthetic risk whatsoever. And my results with this sling are much better than what is reported in the literature for the so-called UBAs, the urethral bulking agents. Like I said, they say it's about 80%, but that tends to wear off very quickly, where the satisfaction rate is not as high, whereas my procedure with the sling, satisfaction rate stays extremely high, 95 to 100%, even at 3 and 4 years later. One of the reasons why I find that it's interesting to talk about stress incontinence and these 2 options is because so many of you do not seek medical attention, maybe because of this scare of mesh, this old story about polypropylene mesh with complications, which involved lifting the bladder, had nothing to do with the urethral suspension or mid-urethral sling, which is what we're talking about. Another reason is a lot of you are simply embarrassed. You just don't want to talk about it. You just don't want to admit it, and you'd rather just wear panty liners or pads until it becomes such an issue that you're fed up with it, and when you could have had it fixed months, even years prior. So you don't bring it up to your friends, you don't bring it up to your significant other, you don't bring it up to your primary doctor, and so that's another reason. Stress urinary incontinence is reported to be anywhere between 25 and 30% of the female population, and sadly, only about half of those, maybe 12-13%, ever really seek medical attention. So that's an extremely large number if you think about it. So please don't be embarrassed by it. It's extremely common. Now you know It's 1 in 4, okay? So it's very, very common. You should talk to your primary doctor about it. Find a urologist who can talk to you about urethral bulking agents, and of course, some sort of mid-urethral sling. I think the Solic sling using the Mrs. procedure is the best. So don't let a leaky bladder issue plague you for the rest of your life. Get back to normal activity. You should try to find a way to get completely dry and enjoy your life, and quit wearing panty liners and changing clothes. I mean, get back to some sort of normality and regain that confidence and youthfulness in your life. So look me up at rclaywilliamsdo.com. At University of Texas Health East Texas. You can also go to that website as well and find me. Either way, I'll be happy to do a consultation with you and just see what's going on and go over these options with you, and maybe you're a candidate for one of these. So look forward to talking to you, and hope you have a great day.